तो ब्रोंकोडायलेटर पे हम थे। Bronchodilator are the drug used to open up the narrow air passage by the dilation of the bronchi and the bronchioles, and thus they facilitate the breathing process. They help to relax the smooth muscles around the bronchi and thus they help to diminish the bronchospasm. So hence the bronchodilator, understand हुआ होगा आपको bronchodilators. If you understand the bronchodilator, we can take the example of the one of the pipe through which the air gases can be passed. If swelling is there inside the pipes, means the opening is narrow, means the air passage is reduced. Again, opening is narrow, inside lining is narrow. Then again, air passage, flow of the air passage reduce. Means the required air exchange not possible when there is a swelling inside the bronchi, narrowing of that bronchi. Along with the muscles is also contracting at that parts. So at that cases, it is because of the inflammations or in the asthmatic condition, it may be possible. So at that times, a drug is required which dilate that the bronchi. So at that time, the bronchodilator drugs are given. Okay, and these drugs can be given in the form of air passage, means the in the form of the rotahalers, inhalers forms. Now the drugs are given in the inhaler forms because the required action is within the fractions of the minutes we can get. So that inhalers, as that inhalers we are taking the drugs through the inhalers, that acting out that particular bronchioles and the opening is dilated. So these types of drugs are the bronchodilators. Okay, next one was the decongestants. In the decongestants, the congestion is created in the nasal cavity where because of the nasal secretions leading to the accumulation of that particular nasal secretion fluid and that accumulation causing the nasal obstructions and sometimes there of the vasoconstrictions of the nasal is to be removed by using the decongestant drugs. The chemical agents which reduce the accumulation of the fluid due to the excessive secretion from the nasals and the paranasal glands and clear the air passage of the obstruction and reduce the any inflammation is there. These types of drugs are decongestant drugs. There is the categories of this. Okay, one is the local decongestants, systemic decongestants. Both the part we have covered in the last lecture. Next is the antitussive. The cough syrups tablets are also there. Antitussive tablets. Antitussive tablets are chewable tablets So in this case, in case of the irritations in the respiratory tract start from the pharynx, trachea, bronchi. These all parts are included in the respiratory tracts. So when there is an infection in the pharynx, trachea, and the bronchi, which produces the tussle impulses, and which carried out by the fibers in the vagus and the sympathetic nerves and the center of the brain, that is the medulla also, which causes the spasm, bronchospasm, and sometimes it initiating the cough action also. So this for this remove antitussive drugs are used. So the if we understand the antitussive are the agents which depress the area in the central nervous systems, because for each activity there is a center in the central nervous system which is responsible for the reflex actions. These are the agents antitussives. These are the drugs which generally activate the central nervous system that point, that centers, and which control the cough reflex. And this result in the suppression of the cough, and hence they are called as cough suppressants. So how important is the central nervous system is there? That's why it is called as the controlling unit of the body. Cough center is also there. That is cough reflex is also there, which control the cough, which depress the. If you take the antitussive, that depress the that particular cough centers, which suppress the cough. So these are the antitussive are the cough suppressant types of drugs. So expectorant, bronchodilators, decongestants, antihistaminic agents, these all are in the cough syrups are there. If you see the cover of the cough syrups, you will definitely find these types of the drugs there. It may be the antitussive, it may be the anti-expectorant, it may be the bronchodilators, decongestants, it may be the antihistaminic agents. So it helps to suppress the cough and they help the expectoration and produces the protective and the soothing effect for the required actions. And if you see the classification of this antitussive, one is the drugs is there. Ambroxol is the most common drugs. Usually in each of the antitussive drugs syrups there are ambroxols. So it is a derivative of the cyclohexanol. The role of the ambroxol is to break the phlegm and used to treat the respiratory diseases and make thin the mucus, and it is act by clearing the mucus, and it make the ease in the process of the removing that particular mucus through the coughing, and it is active ingredient in the cough syrups. Okay, how it is synthesized? Synthesis are given here. Synthesis: paracetamol is the starting material. Its hydrogenation is there and give the one first intermediate, that is trans 4 acetamido cyclohexanol, which is reacted with the base and give the trans 4 amino cyclohexanol. Then trans 4-amino cyclohexanol is then treated with the 2-amino 5-dibromobenzaldehyde and which hydrolyzed to give the ambroxol. So this is the structure of the ambroxol. Ambroxol is the structure, starting material is there. Next is the salbutamol. Then the salbutamol, it is also one of the important drug intensive category. It is acetylene or albuterol structures having the hydroxy groups attached the main structures. And salbutamol is one of the important drugs, that is long-acting drugs, and act as the bronchodilator also, which is generally given in the combinations with the theophylline. Theophylline, we have studied the theophylline in the asthmatic condition. Generally, theophylline also preferred. So it is the belonging to the class of the beta phenylethylamine. Most important category in the case of the bronchodilators. The what is used as the salbutamol? So salbutamol is used as a bronchodilator, which is administered orally or inhalations, and it suppresses the inflammation of the respiratory tract, coughing and wheezing. Sometimes कभी कभी क्या होता है, सांस लेते वक्त सीटी की जैसी आवाज आती है. तो ऐसे केसेस में क्या होता है कि जो ब्रोंकाई का जो है साइज कम हो जाता है, सांस लेने में तकलीफ होती है, सांस आसानी से ले नहीं पाते, नींद नहीं आती, उठकर बैठना पड़ता है, अटैक के टाइप का होता है. तो सीटी भी बजना बोले तो एक क्या है, सिम्टम्स है अस्थमा का. ओके, ट्रिगर्स रहते हैं बॉडी के अंदर. वो ट्रिगर्स अगर जो कर दिया उसने, यानी किसी को एलर्जी होती है धूल से, किसी को एलर्जी होती है पोल्यूटेंट से, किसी को एलर्जी होती है एटमॉस्फेरिक चेंज से, किसी को एलर्जी होती है पैथोजन से, पोलन ग्रेन से. बुक्स के अंदर जो है धूल होती है, पुराने बुक्स ओपन करने के बाद किसी को एलर्जी होती है डस्ट से. तो ऐसे टाइम में क्या होता है, वो ट्रिगर जो होते हैं उसके वो एक्टिवेट हो जाते हैं, और ट्रिगर एक्टिवेट होने की वजह से वो जो ब्रोंका है उसमें स्वेलिंग आना चालू हो जाती है. अब नैरोइंग ऑफ द ब्रोंका हो जाता है, उसकी वजह से वहां पर जो है सीटी की जैसी सांस में आवाज आती है. तो जब भी कोई पेशेंट डॉक्टर के पास जाते हैं और वो पेशेंट अगर जो अस्थमेटिक है, तो डॉक्टर पूछते हैं कि आपको कैसा क्या हो रहा है, क्या तकलीफ है. तो उस टाइम में ये सारी चीजें पेशेंट बताते हैं, तो उस टाइम में वो हिसाब से उसको ड्रग देते हैं. डायलेटर का नाम का ड्रग्स दिया जाता है उसको, विच इज एडमिनिस्टर ओरली और बाय इनहेलेशन, इनहेलर के फॉर्म है, जिसकी वजह से सप्रेशन ऑफ द इन्फ्लेमेशन occurs, suppression of the coughing and the wheezings, and reduces the respiratory. अब साइड इफेक्ट, साइड इफेक्ट विजुअल डिस्टर्बेंस. नेक्स्ट है ऑक्सीमेटाजोलिन. ऑक्सी, one of the drugs, it is used to nasal decongestants. अब इसमें होता क्या है, नेजल डिकंजेस्टेंट में आपने पर की टाइप्स की दवा होती है. दिग्धा ऑक्सीमेटाजोलिन which clear the nasal passage Okay, it may cause the hypertension due to systematic absorption. इसका स्ट्रक्चर यहाँ पर दिया हुआ ऑक्सीमेटाजोलिन का. This is the important structure. Next is the codeine phosphate. This is the important drugs of the cough syrups. Codeine phosphate is there. If you see the cover of the cough syrups, there is a codeine phosphate is also there. But it is a, sometimes it is a habituals. Habit भी create कर सकता है ज़्यादा लेने वाले लोगों को. It is used as a phosphate and it is more soluble in sulfate. Codeine phosphate is a highly effective antitussive agent, but it has weak analgesic actions and belonging to class opiates. साइड इफेक्ट में क्या आ सकता है इसके कि एडिक्टिव एंड कॉज द नोजिया एंड कॉन्स्टिपेशंस. अब ये एडिक्टिव होने की वजह से इसकी एक सायरप आती थी कोरेक्स सायरप बोल के जिसके अंदर कोडिन फॉस्फेट होता था, तो लोग उसे नशा करने लगे थे. वो इतनी बिकने लगी कि उसका शॉर्टेज हो गया पूरा मार्केट में कोडिन फॉस्फेट का, जिसकी वजह से फिर वो विदाउट प्रिस्क्रिप्शन अभी दी नहीं जाती या फिर बहुत सारी जगह पे मिलती ही नहीं है. तो एक रिक्वायर्ड इफेक्ट क्या है इसका कि बहुत अच्छी तरह से एक्ट करने वाली एंटीटसिव एजेंट है, लेकिन मिसयूज होने की वजह से ये जो है विदाउट प्रिस्क्रिप्शन की दी नहीं जाती, बहुत सारे मेडिकल में अवेलेबल भी नहीं है. सो these are all categories of the drugs. Okay, so next topics we will start the dyes. Okay, drugs के पूरे कंप्लीट हो गए. ड्रग्स